Hi guys, it's Tom. I'm a junior doctor and entrepreneur in Melbourne. In this video, I'm going to take you through how to create the ultimate one-pager. Anything in medicine and in life can be summarized into one page that you can study and store for your knowledge. If you want to see more content from me, hit the subscribe button now, click like and hit that notification bell to find out about all of my videos. And without any further ado, let's get started. So in my last video, which you can see here, I focused mostly on the kind of high-level hierarchy. Presentations and conditions falling underneath. Presentation being someone presenting to hospital with chest pain, and then all of the conditions that fall underneath. Now, the questions and the comments I had in that video were, okay, great, well, how do I actually study the condition? And that's where the one-pager comes in. So step one of making a one-pager is deciding what the structure will be. I use BMJ best practice, their overall kind of hierarchy of how they structure their study of conditions. You can see here they break it up in a very nice way. So they've got an overview, which you don't need. They've got theory, which includes things like the epidemiology, the etiology, or the kind of the pathophysiology. So how does it work? What actually is the condition? You also got history and exam, which is really important for clinical exam study, investigations that you would get, and also what results you would expect to see on those investigations, importantly. Other differentials, which is not as important, and then a bit about management, treatment algorithms, that kind of thing. So I didn't use BMJ for all of the headings themselves, but I used roughly the headings here. The final selections of headings that I used was epidemiology. I did pathophysiology, which for BMJ terms is etiology. I did history and exam, so important positive findings or negative findings on history and exam. I did investigations and the likely results that I would see in those investigations. And I did management plans, so what are those initial sort of management steps that you would do. I have to be honest, it's pretty challenging to include all of the management steps in a one-page document. The main thing you want to achieve with these one pages in medicine is to really understand the condition. Okay, so now we have our kind of one-pager headings. So like I said, I was a pen and paper person, so I used something called Rocketbook, which I'll put an example of Rocketbook here. Basically, it's this really cool technology where you can write pen and paper on a book and use a phone to PDF scan your notes into the cloud. And the notes, they look kind of like this. So if you're a pen and paper person, I highly recommend Rocketbook. I have a link in the description explaining like an affiliate link to download it, but I use that a lot in my study. But like I said, I lost all those PDFs during a transfer. So if I was studying again, I would actually probably use something like Notion. I just like the way with Notion you can nest different conditions under presentations, and it's all linked to like your own internal kind of website. So let's jump into my Notion and make a condition sheet. In here I've got presentations. So I'm going to add it under chest pain, and I'm going to add a new condition, non-ST. So for each of the properties, I'm going to add my different fields. I've created the non-ST elevation myocardial infarction Notion page. You can see each of the different sort of things. And I would also include the links to the resources that I would use. So something like that. And if you use other things like osmosis, we might, use some MedicGuild articles or something like that. You can copy in the links however you want in here. Maybe, some sort of MedicGuild article that's relevant. So you include it all in the comments, right? And then for the epidemiology, I would typically use BMJ because I found it to be the most evidence-based and accurate. A lot of others don't include it. So let's do this. So you can see epidemiology, cardiovascular disease. Okay, that'll do. Pathophysiology, so I found BMJ to be a pretty good balance typically. So they would give you a lot of information, but then you could, essentially like take out what you wanted to take out, right? Obviously, you could go into a lot more detail on pathophysiology, and that's the cool thing about Notion. So you could, if you wanted like a whole category on pathophysiology, you could actually create another page. Yeah. gonna copy the link, and then right, and now I've got this permanent link that sends me to that kind of nested information if I want more information. All right, so let's keep going. And look, I know full well a lot of people like different resources, so if you don't like BMJ, you can use anything, but I found this to be extremely valuable in my studies. Okay, so I used to include most of the common and uncommon findings as well. So chest pain, so sort of like a heavy chest pain, usually retrosternal and usually referring to kind of anywhere effectively. So I would just summarize this. And let's just say, I was in a lecture and one of the clinicians that I really admire said something like, beware that patients with diabetes or any autonomic neuropathies, or often female patients, don't present in this sort of stereotypical way, so they may or may not get this kind of classical set or syndrome. So then in that situation, I might jump into this note and write something like, beware, patients can present atypically, especially diabetics, females, elderly. In BMJ, they mix sort of the symptoms being the history things and the signs. So we can see here that the only ones that they've listed on physical examination are things like arrhythmias or abnormal heart sounds. So we'll include those, but to be honest, with acute coronary syndromes aren't that many. So assuming you've finished your one pager, right? So once you've finished your one pager, then the cool thing is you can then share this link everywhere, right? So you can go back. So there are different ways to achieve this, but for me, so I would just copy the link, go to shortness of breath, click into like a new task, link to page, that's it. So now I've got my non-ST elevation in all the relevant presentations that I want, right? I've got it in both places. You can basically create these kind of super sheets, right? Like every time you walk into a lecture or you're asked to study anything now, you have this sheet and you can jump back to this sheet, go through it again as someone in the lecture is talking about a new thing. You can do quick find. So if I want to find my my ST sheet, I can find my ST sheet, right? And other important tips. So I would call something like original, right? And then anywhere where it's not the original would just be a link. So in this one, it's not the original, right? It's just a link. So then when I search non, I can see that I've got the two options. So I'm just going to go to my original and then I'll start studying from here. So that's it. That's how I used to create one pages, how I'd use BMJ, other resources like Life in the Fast Lane, textbooks. If you like the video, click the like button, hit subscribe, hit that notification bell. I'm still committed to making these weekly videos. I hope you're enjoying them. And if you haven't watched that other video, watch that video now, how did I get perfect marks in my clinical exams. And thanks for watching.